other question for you, not regarding me. My grandmother's kind of at the end of the line with her teeth.
Okay.
I'm not sure if dental implants would be the best route for her.
There are several options. A dental implant can replace an individual tooth or several teeth. It can also replace all of your teeth when you combine it with a denture instead of a crown or individual tooth. This is an example where we have a couple of implants in the mouth, and then we have the abutments or the little connectors that come out of it. And then inside of the denture, you see those little snaps? There are small snaps that snap onto the denture. And that way, instead of a denture that's loose and flopping around, it snaps right on. It's very strong, it's very firm. And we find that it's night and day in terms of people's satisfaction with dentures. You can still take it off, you can still clean it. We can have two of them if you should ever have an accident. And then implant-supported denture is a great way to go.
Okay. I've heard bridges are the way to go. Why would an implant be better than a bridge?
That's a great question. Bridges have been around for a long time. It's a very tried and true procedure. When you have a missing tooth, it connects the two teeth on either side with crowns or some other type of connection onto them to bridge the gap. The catch with bridges is they tend to get cavities underneath of them. Secondly, the bone shrinks away underneath where the tooth was taken out. And so a dental implant it doesn't involve the adjacent teeth. Many times those teeth are fine. There's nothing wrong with them. We really don't want to put a crown or a cap on top of them. We would just put the dental implant in where the missing tooth would be. That way you don't have to mess with the other teeth, and you don't open a whole can of worms in terms of maintenance items. And you just replace the tooth. The dental implant preserves the bone, keeps it from shrinking, and also cannot get a cavity.
Does insurance cover these dental implants?
That is a great question. More and more insurances do these days, but not all. So what we try to do for you is we have one of our front desk staff, who are terrific and they're trained in all that, do a complete insurance rundown for you. You give them your card, your information, and they'll do a complete rundown for you and figure out what they cover, what they don't, what percentage they cover, and then we'll give you a complete written estimate with a breakdown on any out-of-pocket expenses you might incur in the process. We'll break it down for you in terms of a timeline, how long it takes, how much it costs, and what's involved.